Every 3 seconds, someone around the world suffers a stroke. In the time it takes you to watch this video, hundreds of people will experience this medical emergency. But here's what most people don't know. The actions you take in those first critical minutes can literally mean the difference between life and death, between full recovery and permanent disability. Today, we're going to walk through 10 evidence-based, life-saving actions that could help you save someone's life or even your own. I'm going to share with you the exact protocols that emergency medical professionals use, backed by research from leading institutions like the American Heart Association, the World Health Organization, and major stroke research centers. By the end of this video, you'll have the knowledge and confidence to act decisively when every second counts. Let's start with a sobering reality. Stroke is the second leading cause of death worldwide, according to the World Health Organization. But here's the encouraging news: up to 80% of strokes are preventable, and when they do occur, immediate proper action can dramatically improve outcomes. The National Institute of Neurological Disorders and Stroke has shown us that patients who receive treatment within the first hour of stroke onset have significantly better recovery rates. So what exactly happens during a stroke? Think of your brain as a bustling city with an intricate network of roads, your blood vessels. When a stroke occurs, it's like a major highway gets blocked or bursts. Brain cells, which are incredibly hungry for oxygen and nutrients, begin dying within minutes. This is why we call it a brain attack, just like a heart attack, but affecting the brain instead of the heart muscle. The first life-saving action you must master is recognizing the signs immediately. The American Stroke Association has given us a simple acronym that saved countless lives: be fast. Let me break this down for you, because memorizing this could be the most important 5 minutes you spend today. B stands for balance. Watch for sudden loss of balance, coordination, or dizziness. Has the person suddenly become unsteady on their feet? Are they stumbling or falling without explanation? Research published in the journal Stroke shows that balance problems occur in about 84% of stroke cases, making this one of our most reliable early warning signs. E is for eyes. Look for sudden vision loss or changes. This might be partial vision loss, double vision, or complete loss of sight in one or both eyes. The person might tell you things look blurry or that they're seeing double. Studies from the New England Journal of Medicine indicate that visual disturbances occur in approximately 40% of stroke cases and often appear before other symptoms become obvious. F represents face drooping. This is probably the most well-known stroke sign, and for good reason. Ask the person to smile. Does one side of their face droop? Is their smile uneven or lopsided? Can they feel both sides of their face normally? The National Stroke Association reports that facial drooping occurs in about 95% of stroke cases, making it our most reliable indicator. A stands for arm weakness. Ask the person to raise both arms above their head and hold them there for 10 seconds. Does one arm drift downward? Can they keep both arms up equally? Research from Harvard Medical School shows that arm weakness or numbness affects nearly 88% of stroke patients and is often one of the earliest detectable signs. S is for speech difficulties. Listen carefully to how the person is talking. Is their speech slurred, garbled, or strange? Are they having trouble understanding you or finding the right words? Ask them to repeat a simple phrase like, "The early bird catches the worm." According to studies published in the Journal of the American Medical Association, speech problems occur in about 92% of stroke cases. T stands for time, and this is absolutely critical. If you observe any of these signs, note the time immediately and call emergency services right away. The reason time is so crucial relates to what researchers call the golden hour for stroke treatment. Data from the American Heart Association shows that for every minute that passes during a stroke, the average patient loses 1.9 million neurons. Now, your second life-saving action is calling emergency services immediately, and I mean immediately. Don't wait to see if symptoms improve. Don't call the person's doctor first. Don't drive them to the hospital yourself unless you're in a very remote area with no ambulance service. Call 911 or your local emergency number right now. Here's why this matters so much. Emergency medical services can begin treatment en route to the hospital, and they can alert the stroke team at the hospital to prepare for the patient's arrival. Research from the Centers for Disease Control shows that patients who arrive by ambulance receive treatment an average of 30 minutes faster than those who arrive by private vehicle. When you call emergency services, speak clearly and provide specific information. Say, "I believe this person is having a stroke," and describe the symptoms you're observing. Give the exact address and any landmarks that might help the ambulance find you quickly. If you're unsure about the address, use your smartphone's GPS to get precise coordinates. Tell them when the symptoms started. This timing information is crucial for treatment decisions. Your third life-saving action involves positioning the person correctly while you wait for help to arrive. If the person is conscious and alert, help them sit down in a comfortable position, preferably in a chair with good back support. Keep their heads slightly elevated to help with blood flow to the brain. If they're lying down, gently turn them onto their side, what medical professionals call the recovery position. This prevents them from choking if they vomit and helps keep their airway clear. Research from the European Stroke Organization emphasizes that proper positioning can prevent complications like aspiration pneumonia, which occurs when vomit or saliva enters the lungs. Never leave a stroke patient lying flat on their back if they're unconscious, as this significantly increases the risk of airway obstruction. The fourth critical action is staying calm and keeping the person calm. I know this sounds simple, but research published in the journal Circulation shows that high stress levels can actually worsen stroke damage by increasing blood pressure and heart rate. Speak in a calm, reassuring voice. Let them know that help is on the way. If they're conscious, explain what's happening without causing additional panic. Say something like, "You're having some medical symptoms, and we're getting you help right away. The paramedics will be here soon, and they're going to take excellent care of you." Your presence and calm demeanor can significantly impact their stress levels. Studies from Johns Hopkins Medical School indicate that patients who receive calm, reassuring support during medical emergencies have lower cortisol levels and better overall outcomes. Action number 5 involves monitoring their vital signs and consciousness level. While you're waiting for emergency services, pay close attention to their breathing, consciousness, and responsiveness. Are they breathing normally? Or is their breathing shallow, irregular, or labored? Are they responding to your voice and touch? Can they follow simple commands like squeeze my hand or look at me? If their breathing becomes very shallow or stops, you may need to perform CPR. However, stroke patients who are still breathing should not receive chest compressions unless they go into cardiac arrest. The American Red Cross emphasizes that unnecessary chest compressions can cause additional injury. Instead, focus on maintaining their airway and monitoring their condition. The sixth life-saving action is crucial, but often overlooked. Don't give them anything to eat or drink. This might seem counterintuitive, especially if they're asking for water or seem thirsty, but here's why it's so important. Stroke can affect the muscles involved in swallowing, a condition called dysphagia. Research from the National Institute of Health shows that up to 65% of stroke patients develop swallowing difficulties. If you give food or liquid to someone whose swallowing reflex is impaired, they could aspirate, meaning the substance could enter their lungs instead of their stomach. This can lead to aspiration pneumonia, a serious complication that can be life-threatening. Even a small sip of water could be dangerous. I know it's hard to refuse when someone asks for water, but explain gently that the medical team needs to evaluate their swallowing ability first. Action 7 involves gathering critical information for the emergency medical team. While you're waiting, collect important details that could impact treatment decisions. When did the symptoms first appear? Be as specific as possible about timing. If the person woke up with symptoms, the last known normal time would be when they went to bed the previous night. Try to find out about their medical history. Do they take any medications? Are they on blood thinners like warfarin or aspirin? Do they have a history of heart problems, diabetes, or previous strokes? This information can dramatically impact treatment options. For example, certain clot-busting medications cannot be used if a patient is already taking anticoagulants. So this information is crucial for doctors to know immediately. If possible, gather their identification, insurance cards, and a list of current medications. Many people keep medication lists in their wallets or purses, or you might find pill bottles in their kitchen or bathroom. This preparation can save valuable time once you reach the hospital. The 8th action focuses on what not to do. which is just as important as what you should do. Never give aspirin or any medication unless specifically instructed by emergency medical personnel. While aspirin can be helpful for certain types of strokes, it can be dangerous for hemorrhagic strokes where bleeding is occurring in the brain. Only medical professionals with proper diagnostic tools can determine which type of stroke is happening. Don't try to restrain someone who might be agitated or confused. Stroke can cause changes in behavior and thinking, and the person might become frightened or disoriented. Instead of physical restraint, use calm verbal reassurance. Research from the American Academy of Neurology shows that agitation during stroke is often a sign of brain injury and should be managed medically, not through physical restraint. Also, avoid giving them anything for pain unless they're experiencing severe discomfort and emergency services are significantly delayed. Even then, only give medication if you can confirm they're not allergic and it won't interact with their existing medications. Action 9 involves preparing for transport and hospital arrival. When emergency medical services arrive, be ready to provide them with all the information you've gathered. Give them a clear timeline of when symptoms started and how they've progressed. Share any medical history information you've collected, including current medications and allergies. If you're a family member or close friend, ask if you can accompany the patient to the hospital. Having a familiar person present can help with communication and provide important medical history information that the patient might not be able to communicate themselves due to their condition. During transport, continue to provide emotional support while staying out of the medical team's way. They may need to perform various procedures or assessments, and your job is to be supportive without interfering with their work. The 10th and final action extends beyond the immediate emergency, advocating for rapid treatment at the hospital. Time-sensitive stroke treatments like tissue plasminogen activator, commonly called TPA, must be administered within a specific window, typically within 4.5 hours of symptom onset, but ideally much sooner. Research published in the New England Journal of Medicine shows that patients treated within the first hour have the best outcomes. When you arrive at the hospital, make sure the medical team knows you suspect a stroke and emphasize the timeline of symptom onset. Sometimes emergency departments can be busy, and having an advocate who understands the time-critical nature of stroke treatment can help ensure the patient receives immediate attention. Be prepared to provide the same information multiple times to different medical professionals. This is normal and important for ensuring everyone on the medical team has accurate information. Now, let me share some additional insights that could prove invaluable. Not all strokes present with dramatic, obvious symptoms. Some people experience what doctors call mini-strokes or transient ischemic attacks or TIAs. These might cause temporary symptoms that resolve within minutes or hours. Research from the Mayo Clinic shows that about 1/3 of people who experience a TIA will have a major stroke within a year, often within the first 48 hours. This means that even if symptoms seem to improve, it's still crucial to seek immediate medical attention. Never adopt a wait-and-see approach with potential stroke symptoms, even if they seem mild or temporary. It's also important to understand that stroke can affect people of any age, though the risk increases significantly after age 55. The American Heart Association reports that stroke rates have been increasing among younger adults, particularly those between ages 25 and 44. This means everyone should know these life-saving actions, regardless of their age. Women may experience some stroke symptoms that are less commonly discussed. Research published in the journal Stroke shows that women are more likely than men to experience symptoms like sudden nausea, general weakness, chest pain, shortness of breath, and palpitations during a stroke. These symptoms might be mistaken for other conditions, potentially delaying critical treatment. Let's also address some common myths that could prevent people from taking appropriate action. Myth number 1. Strokes only happen to elderly people. As I mentioned, stroke rates are increasing among younger adults. High blood pressure, diabetes, smoking, and other risk factors can cause strokes in people of any age. Myth number 2. If someone is talking normally, they're not having a stroke. This is absolutely false. Speech problems occur in most strokes, but not all. Someone can have normal speech and still be experiencing a stroke affecting other areas of the brain. Myth number 3. Stroke symptoms are always sudden and dramatic. While many strokes do present suddenly, some develop gradually over hours. Any new neurological symptoms should be taken seriously, regardless of how they developed. The economic and personal impact of stroke makes this knowledge even more critical. According to the CDC, stroke costs the United States healthcare system more than $56 billion annually. More importantly, stroke is a leading cause of serious long-term disability. About 80% of strokes are preventable through lifestyle changes and proper medical management of risk factors. Risk factors you can control include high blood pressure, smoking, diabetes, high cholesterol, obesity, excessive alcohol consumption, and physical inactivity. The American Stroke Association emphasizes that managing these risk factors can reduce stroke risk by up to 80%. However, some risk factors can't be changed, including age, gender, race, and family history. African Americans have nearly twice the risk of first-ever stroke compared to Caucasians, and men have a higher stroke risk than women, though women have higher stroke mortality rates. Let me share a real-world perspective on why this knowledge matters so much. Emergency room physicians report that patients who arrive quickly and receive immediate, appropriate care have dramatically better outcomes. Dr. Jeffrey Saver from UCLA, a leading stroke researcher, has calculated that every 15-minute delay in treatment reduces the likelihood of a good outcome by about 4%. This means that your quick recognition and appropriate response could literally determine whether someone walks out of the hospital or requires months of rehabilitation. It could mean the difference between someone returning to their normal life or needing assistance with basic daily activities. The technology and treatments available for stroke have improved dramatically in recent years. Advanced imaging techniques help doctors quickly determine the type of stroke and the best treatment approach. Mechanical thrombectomy, a procedure where doctors physically remove clots from brain arteries, has revolutionized treatment for certain types of strokes. However, these advanced treatments are only effective when patients receive care quickly. Rehabilitation after stroke has also advanced significantly. Research shows that the brain has remarkable plasticity, the ability to form new neural connections and recover function even after injury. However, early intervention and proper acute care create the foundation for successful rehabilitation. As we wrap up, I want to emphasize that learning these 10 actions isn't just about being prepared for an emergency, it's about being empowered to make a real difference in someone's life. The knowledge you've gained today could help save a family member, friend, coworker, or even a stranger. Practice the Be Fast assessment with your family members so everyone knows what to look for. Keep emergency numbers easily accessible, and make sure family members know important medical information about each other. Consider taking a CPR and first aid class to build on this knowledge. Remember, when it comes to stroke, time is brain. Every minute matters. Every action you take matters. The 10 life-saving actions we've discussed today, recognizing BFAST symptoms, calling emergency services immediately, proper positioning, staying calm, monitoring vital signs, avoiding food and drink, gathering medical information, knowing what not to do, preparing for transport, and advocating for rapid treatment could mean the difference between life and death, between recovery and disability. Most importantly, don't hesitate to act. It's better to call for help when it turns out not to be a stroke than to delay when it is one. Emergency medical professionals would rather respond to a false alarm than miss the opportunity to save someone's brain function and life. Thank you for taking the time to learn these critical life-saving skills. Share this information with your friends and family. You never know when you might be called upon to use it, and now you're prepared to respond with confidence and knowledge. Together, we can improve stroke outcomes and save lives, one person at a time.